for giving me an opportunity to speak in this gathering. It's a really pleasure. And this conference is multifaceted. That is why I put all the colors in conference. The most important aspect of any treatment is that the treatment should be effective. And for it to be effective, whatever we give, it may be a simple vitamin, it may be a medicine, it may be an anti-detox, anything for detoxification, unless it reaches its target, it is not going to be effective. That is where the role of circulation comes in. Because without the circulation, it cannot reach its target point. So, it is very important for us to have good circulation, to carry the oxygen, to carry the nutrients, and to carry whatever we want to give from outside. And also, equally important is to remove what is not wanted in the body. Just imagine, you are not able to eat anything, you are not able to breathe anything. You will die. But if you are not able to remove what you have, you are going to be tortured. Imagine in the morning you go to the washroom and your flush is not working and the whole family has to go to the same place. What will happen? So it is more important to detoxify than to kill the nutrition, and that is not possible unless you have got proper circulation. Years back, the President of India, Dr. Abdul Kalam, had said that external counter pulsation has applications for many diseases. At that time, we were only thinking about the heart. But he was a visionary and he said this in a number of places, in a number of conferences, that it has role in many diseases. And first I will tell you about the EECP, then I will go ahead with how I connected with anti-aging. EECP, external counter pulsation. From outside the body, we are raising the pressure in the diastolic phase where normally it is lower, in a pulsatile fashion. A patient lies on the bed after wearing slacks. Cuffs are tied around the legs. In our case, we are also using the arms for the cuffs. Electrodes are attached and the pulsation is started pneumatically. At present it is pneumatic. We are working on doing it with electric stimulation of the muscle as well. It is not available anywhere, I think, but we are in the process of developing it. I'll just put it very shortly. What it does is, this thing repeated again and again. It is 1 hour a day for 35 days. Number one, it dilates the blood vessels, so more blood can go. Number two, it opens up the dormant blood vessels which God has given us and reserved, but they are not opened up. They open up. And some chemicals, hormones are produced by the endothelium which stimulate the genesis of new blood vessels. So angiogenesis takes place. And these together, they enhance the blood supply. It is well recognized, but less awareness is there. So surprisingly, this is something which is mentioned in Harrison, is mentioned in Braunwald, Hurst, cardiodiabetic update, and 2024's current medical diagnosis and treatment also refers to it. It is recognized by so many published, but still the awareness is still lacking. When the circulation stops, the game is over. The heart, angina, heart attack. The nervous system is very sensitive. In few seconds, a person becomes unconscious. Prolonged, it becomes a vegetable. Prolonged, it is game over. Lungs, they fail to give oxygen and they fail to remove the carbon dioxide. Game is over. Kidneys, they survive longer. Any organ which survives longer, we are able to transplant that and take advantage of it. That is why kidney transplant is more common. Normal cell has got minus 70 millivolt in our each cell, the potential. After death, this starts coming down. The cells which die early are those where this comes down early. It takes around 4 hours after we declare a person dead or think he's dead for all the cells to actually die. So, some may die early, some may die late, but it takes around 4 hours for all of them to die. Because this 4 hours is the time for the cell membrane potential to go from -0 to -70 to 0. And that is when we are really dead. Each cell of ours is dead. Liver, same thing. Then stomach, intestine, muscles, they develop stiffness, rigor mortis. Bones, they are not directly affected, so they take longer time. Reproductive organs, skin, because person becomes pale, it becomes waxy. Now, let's put it the other way around. When a person smiles, when a girl blushes, why does she look beautiful? Because the circulation of the skin increases. Why do we say pink of health? Again, it is the circulation. I don't know whether this word pink of health, this sentence was developed, but it was some visionary who thought pink of health is again related with circulation. I'm rushing through it. Anyone who wants the presentation, I'll give it to you. Nails, hair, they are not living and they are not directly affected, but the new coming up hair and nails, they are affected. Lymphatic system, again the same thing. Endocrine. And when we think of blood circulation, now this is where the whole thing rises, where what I want to impress upon. When we think of blood vessels, we think of blockages. We want to get rid of the blockages. The dilemma is, how do we decide about it? We see so many patients, 90%, 99%, 100%, blood vessels, the coronaries are blocked. And the patient says, I have not had any problem, doctor. Are you sure you are right? Another patient, he comes. He says, I have got chest pain. He's taken for angiography and he's told me I have got normal coronaries. Where have we gone wrong? That is very important. Angiography, is it reliable? Is it correct? Is our diagnosis right? I will say angiography is correct, but it is not reliable. It is not reliable because the way we are thinking, we are made to think, is something has gone wrong somewhere which have affected the heart. Number 2, blocked coronaries cause ischemia or angina or heart attack. Wrong. It is not the blocked blood vessels. Otherwise, the 100%, 90%, 99% blockage in angiography would have killed the patient. So it is not the blockages. It is the blood flow which is important. It is the blood flow when it is less that the angina and heart attack takes place. What I am talking about, the heart valve is equally applicable to every single organ in the body. Why? Because angiography can only see the larger blood vessels. It cannot document the smaller blood vessels. It cannot document your capillaries. And when we are doing angiography, we are not seeing the collaterals which nature has already developed in us. As a patient who has got 100% blocked blood vessels, He is very lucky, but nature has already treated him if he is not getting angina. So the fault is that we are relying too much on the angiography and we are concentrating too much, almost negligible, on the blood flow. Now, how does it change our thinking? Once we think of blockage, we want to remove the blockage. And we want to remove the blockage, we are thinking of angioplasty, stent and bypass. But let us now see the other way around. We are not thinking of blockage. If we are thinking about blood flow, then we will not think about stent and bypass. We will think about other ways of improving the blood flow. It can be with medicines, it can be with ECP, ESMR, elation. So it is a whole thinking process. Once you do angiography, you are thinking of blockage, you are thinking of stent and bypass. Once you are thinking of blood flow, then you are thinking of ECP, ESMR, elation. And after that, you will think about stent and bypass. So now come to the indications of the ECP. Coronary artery disease, congestive heart failure. But as I said, this is equally true throughout the body. It enhances blood flow to almost every organ in the body. So it is truly a holistic treatment. Peripheral artery disease. We have treated a number of patients of peripheral artery disease. And as you can see over here, the collaterals develop quite well. Brain. The planning capacity of a person decreases with age because the blood flow decreases besides other things. If you are able to improve the blood flow, we are able to improve the planning capacity of the brain. We are able to improve his memory. We are able to improve his thinking process and overall mental well-being. One of the patients which I saw in UK, he was having a treatment for Alzheimer's disease. His wife had brought him on a wheelchair, and she said that when he goes to the toilet, I leave him there, he does not know where he is. So these are the patients that, depending on the extent of disease, we may be able to help if we are able to improve their circulation. Parkinson. These were the studies from China, where the effective rate was 92% with ECP and with medicine 81%. Another study was 73% with ECP and 43% with medicine. We are doing it for Parkinson. So far, we have not been able to achieve the success as reported in the journal. What we have seen is patients have reported around 40-50% improvement. But I'll say a disease which has got no treatment, a disease which is going to progress, a disease which is going to cripple the patient, even 5% improvement should be very good. But we are personally seeing around 40-50% improvement in patients with Parkinson's. Alzheimer's, I just told you, tinnitus. Yeah, this is another very interesting thing. Vision improving. I have seen patients elderly patient, around 80 years or so. Previously, he could not recognize this distance. But one day, he was a saint and he was having a religious discourse and he had invited us. In the darkness, it was night time and it was in the open. I was sitting around the end of this, where the last row is. From that distance, he could recognize me. Hearing, the same person. Previously, he was quite hard of hearing. After the treatment, his disciples told me, "Hey, Dr. Sibia, you have caused a problem for us." So I said, what has happened? He said, but first, Babaji, we call any elderly or religious person. He said, first, Because these are the youngsters who are there. First we would keep on talking about ourselves, the thing which any young person would talk, which elders would not like. He said, okay, but now what is happening is he's able to hear what we are speaking and we get fired. So the improvement in the hearing. Erectile dysfunction. I think this is the most less spoken, most related with anti-aging. And I'll just give you one instance. One of our patients, he was murdered because he took treatment from Dr. Sibia. What happened is he was a widower, and first he through a friend of mine, he said, tell Dr. Sibia he should not treat those males who are not living with their wives or who are widowers. So I asked him what happened. He said the libido has gone up. And what happened is his wife was not there. He started visiting some other female, and in that process he got murdered. So that is, I think, the proof that it works. Athletic and sports performance, your circulation is going to improve. Aesthetic effect, as I told you earlier, that when a person smiles, when he blushes, the glow is there in the face. In fact, one of the first things that our patients tell us is that those who are known to them, who have not met them for some time, they say, what have you done? You are looking younger. Your face is looking better. These are the first things which the other people notice in the patient, that the face is looking better and younger. Post-COVID, long COVID, the quality of life, improved cellular function, improved oxygen delivery, reduced oxidative stress, slow down cellular aging. Now what do we call such a treatment? Which improves everything from head to tail, improves your cognitive function, your memory, clarity of thinking, hearing, vision, gives you a youthful look, skin is glowing, kidney then decreased in the creatinine in those patients in which it has risen. Now we are also using ESMR for this purpose. Enhanced sexual function, improved supports and athletic performance. I think there's only one word for this, and that is anti-aging. Whatever you may call it, fountain of youth, anti-aging elixir, and in different religions, somras and all, it is called different things in different languages. So what is the most important aspect which you can add on to whatever you are doing? Whatever means whatever therapy you are doing is the ECP. And I strongly recommend that whatever you are doing for aesthetics, for anti-aging, for healing, I think this can be add-on treatment to enhance the effect and make more effective whatever treatment you are doing. To know more, you can simply contact me. And I'm again thankful to the organizers, I'm thankful to the audience, and I'm really happy to be here. Thank you. Thank you very much. How you can?
How do you prescribe what dose?
What dose?
Every
the best dose, what I feel is 1 hour a day, 5 days a week for 35 sessions. But there's a catch to it. That is, what dose is prescribed depends on many factors. 5 days a week started with USA. So they are having a 5 days a week work. We were having 6 days a week. Because we work 6 days a week. Some patients who come from abroad, they don't have the time. So they take treatment 7 days a week. Some patients, they have less time. What studies have shown is that 2 hours a day is giving equally good results. So I'll say I prefer best 1 hour a day, 5 days a week. Shortest period, 1 session in the morning, 1 after 1.5 to 2 hours. That means 2 sessions a day for 35 sessions. So that's the shortest you can have, and that is the longest. I'll say that there is really no fixed rule. I don't think that enough comparison has been done. I personally do not prefer twice a day. I think it is more commercial than medical. Yes. You take the phone.
Hello. Hi. Dr. Sibia, how are you? I'm Kenny. Thank you so much for being there, always for the ECP community. In your slide, you talked about the ESMR. The ESMR, how do you do ESMR before, during, or after, or how do you sandwich them in combination? That's the first question. Second is the chelator that you use, chelation. Is it ETTA? Chelations? Do you use any other DMSA or DMPS or DDPA, any other? Yeah, two questions. Thank you.
As far as chelation is concerned, I'm only doing EDTA chelation therapy. I'm not doing anything else. I'm not doing all the other chelations. I'm doing them in a very, very small way where it's required. 99% I'm only dealing with the EDTA chelation. ESMR, if I see the three, how to plan them, normally you can give them anytime. But what is important is, if a patient has got more calcification, then ECP and ESMR will work better if we do chelation first and then we do the ESMR ECP. So I think best should be start with chelation therapy. After that, or depending on time, add on the ECP, and in the end do the ESMR. If I see the three, how to plan them, normally you can give them anytime. But what is important is, if a patient has got more calcification, then ECP and ESMR will work better if we do chelation first and then we do the ESMR ECP. So I think best should be start with the chelation therapy. After that, or depending on time, add on the ECP, and in the end do the ESMR.